We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it. Preserve safety. You make sure that patient and public safety is not affected. You work within the limits of your competence, exercising your professional duty of candor and raising concerns immediately whenever you come across situation that put patients or public safety at risk. You take necessary actions to deal with any concerns where appropriate. So the safety of patient is utmost important. You should always preserve the safety of the public. If you come across any concerns, you need to raise your voice. You should take some action to deal with it. Number one statement is recognize and work within the limit of your competence. Whenever you are taking any responsibility, you should be capable of doing it. You should have the skill. You should have that competence to do it. If you don't have it, you should be vocal about it. You should tell your colleague about it. Do not just take anything which you cannot do. It should be in your limits of competence. How can you do it? Accurately identify, observe and assess signs of normal or worsening physical and mental health in the person receiving care. You should be able to diagnose the physical and mental health of the patient who is receiving this care. Make a timely referral to another practitioner when any action, care or treatment is required. You should know when to call a particular practitioner if you need him for particular treatment. You should be able to recognize that the patient needs it, and accordingly you should inform. Ask for help from a suitably qualified and experienced professional to carry out any action or procedure that is beyond the limit of your competence. Again, if you are not able to do a particular procedure or anything, you should always call up. You should always take off the help of the qualified healthcare team, whoever is available. Take account of your own personal safety as well as safety of people in your care. You should take both safety, your and the person's safety also. Complete the necessary training before carrying out a new role. You should have a proper skill to complete your work. So even if you are not competent, make sure that you don't take up the task if you don't know it, but later on learn the task, learn the procedures, or make yourself skillful so that next time you can do it in the best possible way and you have the skill. Next statement, be open and candid with all service users about all aspects of care and treatment, including when any mistakes or harm have taken place. So whatever actions you take, whatever treatment you give, you should give whole information to the patient about it openly, and it should be unfiltered. That is what called as candid. How to achieve this? Act immediately to put right the situation if someone has suffered actual harm for any reason or an incident has happened which had the potential for harm. So while giving any treatment or coming across to any particular patient, you see that something risk is going to happen or some or other problem is going to arise, make sure that you take the appropriate step to rectify the mistake immediately. Do not hide it due to anything. Even if you have done it, make sure that you rectify it then and there and inform the patient as well as your colleague. Explain fully and promptly what has happened, including the likely effects, and apologize to the person affected, and where appropriate, their advocate, family or carers. And if you come across, like again, if you have done any if you have given any wrong treatment or anything happens, make sure that you say sorry. You don't hide it, you rectify it, you record it, and you apologize for it to the caregiver, to the advocate of the patient, family, or carers. Document all these events formally and take further actions, escalate if appropriate, so they can be dealt with quickly. Never hide anything, document everything in a proper and true manner. Whatever mistakes are done, what the precautions were taken, or any actions were taken for it, document everything. Next statement, always offer help if an emergency arises in your practice setting or anywhere else. Our profession is a noble profession. We should be coming forward to help anyone in need for their health. Only act in an emergency within the limits of your knowledge and competence. Again, whenever you are helping, you should be capable of doing it. You should have the knowledge of it, and then only you can come forward when there is some emergency taking place. Arrange wherever possible for emergency care to be assessed and provided promptly. Whatever are in your limits, provide. Make sure that if any emergency happens, you give the emergency care and provide everything promptly. That is fast. Take account of your own safety, the safety of others, and the availability of other options for providing care. You should know that you should keep yourself safe, even your patient should be safe, and also if there is any best option available for treatment, provide it. Next statement, act without delay if you believe that there is a risk to patient safety or public protection. Without any delay, without any due, in a proper time, act if any risk you think will come across. Raise and if necessary, escalate any concerns you may have about patient or public safety, or the level of care people are receiving in your workplace or any other health and care setting, and use the channels available to you in a line with our guidance and your local working practices. If you come across anything which the public is given care or the patient is given care, and if you see that there is something wrong happening, or if you are concerned and it is affecting the patient's health, make sure that you tell it in a proper manner through the line of authority so that the actions are taken promptly. Raise your concerns immediately if you are being asked to practice beyond your role, experience, and training. Again, if you are given something which you don't know and which you are not expertise in, make sure that you are vocal about it. You tell then and there. Tell someone in authority at first responsible opportunity, at the first reasonable opportunity, if you experience problem that may prevent you working within the code or other national standards, taking prompt action to tackle the cause of concern if you can. Whatever the reason is, tell to your authority the earliest as you can. If you are not able to perform anything according to the code, so the proper measures are taken. Acknowledge and act on all concerns raised to you, investigating, escalating, or dealing with those concerns where it is appropriate for you to do. Not obstruct, intimidate, victimize, or any way hinder a colleague, member or staff, person you care for, or member of public who wants to raise a concern. So you should not obstruct, you should not be a hurdle, or you should not intimidate or victimize anyone who want to raise any concern. Protect anyone you have management responsibility for from any harm detriment, victimization, or unwarranted treatment after a concern is raised. Next statement is raise concerns immediately if you believe a person is vulnerable or at risk and needs extra support and protection. If you come across anyone is not getting a proper treatment or is at any risk, raise the concern immediately. Take all reasonable steps to protect people who are vulnerable. Who vulnerable are someone who are sensitive or they do not have that power to do so. So you are capable of doing things for them. Do it. Or at risk for harm, neglect, or abuse. Share information if you believe someone may be at risk or harm in line with the laws relating to the disclosure of information. So if you come across any privacy or any secured information, you can only share it in the line if it is needed, and if because of that information anyone is at risk, you have to share it with those who are in line so that you can help the patient or public, and do not share any unnecessary information. Have knowledge of and keep to the relevant laws and policies about protecting and caring for vulnerable people. You should have knowledge and you should know the policies whom you can tell the information to. Next statement is advise on prescribe, supply, dispense, administer medicine within the limits of your training and competence, the law or guidance and other relevant policies. This statement is prescribe and advise, provide medication or treatment including repeat prescription only if you are suitably qualified. If you have enough knowledge of that person's health and are satisfied that the medicines or treatments serve that person's health needs, you have to be very careful when you are prescribing or advising any treatment or medication to the patient. If it is beneficial to them, then only prescribe it. If you are having the authority to do so, then only prescribe it. Keep to appropriate guidelines when giving advice on using controlled drugs and recording the prescribing, supply, dispensing or administration of controlled drugs. There are few drugs which cannot be given to anyone in a particular quantity. Make sure that you dispense it in a proper manner. You keep a record of it and you have to be careful, mindful. Make sure that the care or treatment you advise, prescribe or supply, dispense or administer for each person is compatible with any other care or treatment they are receiving, including where possible over-the-counter medicines. Whatever medications you are giving, it should not come and it should not be it should not hamper their health if they are taking any other counter medication. Always make sure that you know whatever the patient is taking already and accordingly prescribe and dispense the treatment. Take all steps to keep medicines stored securely. You should take all steps that medications are stored properly. Wherever possible, avoid prescribing for yourself or anyone with whom you have close personal relationship. Do not give any medication to the person who is in your contact or in your rapport. Do it in a proper manner. Prescribing is not within the scope of practice of everyone on our register. Prescribing medication, everybody cannot do it. It's unethical. It is against the few healthcare laws. So there are very few people who can prescribe in the register. In our register means Nmc Code, according to Nmc Code. So nursing associate don't prescribe, but they may supply, dispense and administer medications. They don't prescribe, they give the supply whatever is prescribed. Nurses and midwives who have successfully completed a further qualification in prescribing and recorded it on our register are the only people. So all the nurses also, they don't have the right to prescribe medication. There are few who have completed a particular course or they have completed a particular qualification to do so. Only they can prescribe if they are registered on the site. Next is, be aware of and reduce as far as possible any potential for harm associated with your practice. Take measures to reduce as far as possible the likelihood of mistakes, near misses, harm, and effect of harm if taken. It's always be cautious. Reduce mistakes as much as you can, because the health of the patient is determined on it. Take account of current evidence, knowledge, and developments in reducing mistakes and the effect of them, and the impact of human factors, system failure. Keep to and promote recommended practice in relation to controlling and preventing infection. Make sure that you maintain a proper preventive measures. Take all reasonable personal precautions necessary to avoid any potential health risk to colleagues and people receiving care. You should be cautious. You should take precautions that because of you, no one should suffer. This content belongs to NMC, the code, and here I am explaining the points so that you can do your self-study. The next point is promote professionalism and trust. You can see it in the playlist or in the video further.